Welcome everybody. My name is Emerald and I am an epidemiological specialist for the Department of Health's Immunization Branch and acting coordinator for the school health program. I'm so glad to see in attendance not only school nurses and health assistants, but also school administrators and other school office staff. We welcome members of public and private community health clinics that have joined us today. Please keep in mind that any information that we go over today comes from the state law Hawaii Revised Statutes, Title 11, Chapter 157, Examination and Immunization, also known as the Green Booklet as shown in the PowerPoint. It requires that school principals ensure that their schools admit only students who comply with the state health requirements and shall report to the Department of Health any names of all students who have not met these health requirements by October 10 and January 10 of each year. That is why it is so important that all school staff fully understand these health requirements in order to provide consistent and accurate information to parents about the requirements and know how to properly screen student health records. This will ensure compliance with the Hawaii administrative rules. Before I jump into my presentation, I just wanted to give a brief outline of the topics I'll be going over today. First, I'll share some general information about the health requirements for schools, then show you how to screen a student's health records on the Form 14s, then show you how to complete a school immunization report commonly known as the EPI 12A and 12B reports, and then conclude with some question and answers from all of you. Hawaii law requires each student to present a report of a physical examination, a certificate of tuberculosis examination, and a record of immunizations before first attending school. Each student must have a physical examination within 12 months before first attending school in Hawaii. The exam does not need to be repeated for transfer into another school. A copy of the examination report must be kept in the student's health record at the school. A physical examination must be performed and signed by the following U.S. licensed professionals: a U.S. licensed medical doctor, doctor of osteopathy, an advanced practice registered nurse, or a physician assistant. In March 2018, the governor signed and updated the revised Hawaii Administrative Rules, and this updated rule has significantly changed tuberculosis disease screening practices conducted in the state of Hawaii. For this reason, all future TB-related questions are best answered by the TB Control Branch. Their phone number is listed on the slide. A record of immunizations received since birth, signed or stamped by an MD, DO, APRN, PA, or clinic, must be presented for school attendance. This record must include complete dates, month, day, year for each immunization. An immunization with only the month and year may be accepted if it can be determined that the immunization met the minimum age and interval requirements. For required preschool immunizations, I ask you to please refer to your Green Book Exhibit B, Table 1. For children less than 19 months of age, required immunizations are based on the child's age. For children 19 months of age and older, they should already have 4 DTaP, 3 polio, 1 MMR, at least 1 dose of Hib on or after 12 months of age, 3 Hep B, and 1 varicella. For required immunizations for kindergarteners to grade 12, please refer to your Green Book Exhibit B, Table 2. In that table, it states that all of these children should have 5 DTaP, 4 polio, 2 MMR, 3 Hep B, and 1 to 2 doses of varicella. Please note that 3 doses of hepatitis B vaccine are required for school attendance for all students born after December 31st, 1992, and for 7th grade attendance. 2 doses of varicella vaccine are required if the first dose is given on or after the 13th birthday. Otherwise, one meets the minimum requirements. In addition to meeting the kindergarten through 12th grade immunizations, all students must show evidence of receiving these immunizations prior to 7th grade attendance. Students who receive these vaccines in infancy or childhood do not need to be re-immunized. However, all doses must meet the minimum age and interval requirements. Please refer to Exhibit B, Table 4 in your Green Book for a comprehensive table of exceptions to immunization requirements. First on the list is the diphtheria, tetanus, pertussis combination vaccine. 5 doses of DT are required and must meet minimum intervals. However, the 5th dose is not required for students who receive their 4th dose of DTaP, DTP, or DT on or after their 4th birthday. 4 doses are required for children not immunized until 1 year of age or older, and 3 doses of the adult TD are required for students not immunized until 7 years of age or older. For the polio vaccine, the 4th dose is not required for students who receive only IPV or the inactivated polio vaccine or only OPV, oral polio vaccine, as long as the 3rd dose of a vaccine was administered on or after the 4th birthday. However, if students receive any combination of the two, then he or she has to get all 4 doses. Another exception to immunization requirements is the documentation of immunity by serologic testing. In this situation, laboratory evidence of immunity may be substituted for a record of immunization. This requires a lab report signed by a U.S. licensed physician, APRN, or PA, certifying that the student is immune to the specified disease. This can be used for diphtheria, tetanus, polio, measles, mumps, rubella, Haemophilus influenza type B, hepatitis B, and varicella. A student can also prove clinical history of varicella infection by getting a documented history of varicella signed by a U.S. licensed physician, APRN, or PA, and that can be substituted for the varicella vaccine requirement. Please refer to the Green Book Exhibit B, Table 5 for the minimum ages and intervals between immunization doses. I won't go through each one individually, but I just wanted to point out that there is no maximum interval between doses, and an immunization given before the minimum age or interval between doses will not be acceptable for school entry. On the flip side of that, though, we do have a 4-day grace period. The only vaccines that we don't allow a grace period for, though, are the live vaccines, which are MMR and varicella. Now that I've covered all of the health requirements, we can now discuss provisional attendance and exclusion for the students who do not complete all required immunizations and submit a report of a physical exam before the first day of school. In this scenario, the student can still attend school provisionally upon submitting written proof from a healthcare provider that he or she is in the process of completing the missing requirements. This form is commonly known as the EPI-10B form. As stated before, there is no provisional attendance for students lacking a TB assessment. Students attending school on a provisional attendance have 3 months from the date on the EPI-10B form to complete the missing health requirements. Those who do not complete the missing immunizations or physical exam on time will be excluded from school. Then the school will have to send the parent or guardian a notice of exclusion called the EPI-10D, stating that the student will be excluded for 30 calendar days from the date of the notice. The student may attend school again after bringing documentation showing completion of the missing health requirements. The state of Hawaii acknowledges 2 types of immunization exemptions, medical or religious. Philosophical exemptions are not allowed.
A copy of either exemption must be kept in the student's health record at school. There are no exemptions to the TB clearance requirement. A medical exemption may be granted by a U.S. licensed medical doctor or doctor of osteopathy to specific vaccines. A physician must state in writing that giving a specific vaccine or vaccines would endanger the student's life or health and must specify the reason based on valid medical contraindications. The physician must state the length of time during which the vaccine would endanger the student's health or life, and the exemption certification must be signed by the physician on the physician's printed stationery. A religious exemption shall be granted if the student's parent or guardian signs a statement called the Epi 7, certifying that the person's religious beliefs prohibit the practice of immunization. Please note that a religious exemption based on an objection to a specific vaccine will not be granted. Also, if the Director of Health determines that there is a danger of an outbreak from any of the diseases for which immunization is required, then no exemption shall be recognized and inadequately immunized students shall be excluded from school until the director has determined that the outbreak is over. Now, let's practice screening a health record. Here is a copy of the most recent Form 14 that was released in 2018. We will use this form for our following case sample. Here we have Steve Rogers, born on July 1st, 2013, starting his first day of kindergarten on August 1st, 2018. In the following slides, I will break down all of the major components of the Form 14, making sure that he is up to date on his immunizations and health requirements. First, verify student name and birthday located in the upper left-hand corner. Next, make sure the physical exam was performed within 12 months of the school entry date. It looks like here Steve went to his physical exam on February 10th and his first day of school was August 1st. Next, check to see that the physical exam has a valid provider signature with the physician credentials. A TB examination must have been done within 12 months of first attending school and be issued by the Hawaii Department of Health or a U.S. licensed medical doctor, doctor of osteopathy, advanced practice registered nurse, or physician assistant. When screening the immunization records, always keep in mind the student's birthday and the intervals between doses, making sure that they meet the minimum requirements. Steve Rogers received 5 doses of the DTaP vaccine. The first dose was given on or after 6 weeks of age. The second dose was given at least 4 weeks after the first dose. The third dose was given at least 4 weeks after the second dose. The fourth dose was given at least 6 months after the third dose and not before 12 months of age. And the fifth dose was given on or after 4 years of age. Steve also received 4 doses of the IPV polio vaccine. Looks like the first dose was given on or after age 6 weeks. The second dose was given 4 weeks after the first dose. The third dose was given 4 weeks after the second dose. And the fourth dose was given 4 weeks after the third dose. Steve has 3 hepatitis B vaccines recorded on his Form 14. His first dose was given at birth. The second dose was given 4 weeks after the first dose, and the third dose was given at least 8 weeks after the second dose and 4 months after the first dose, but not before age 6 months. Although only 1 varicella vaccine is required for school entry, Steve received the second recommended dose. The first dose was given after his first birthday, and the second dose was given at least 4 weeks after the first dose. Steve also has 2 appropriately spaced MMR vaccines on record. The first dose was given after his first birthday, and the second dose was given at least 4 weeks after the first dose. Although not the case here, 2 doses of the measles vaccine are required, with at least one of them being MMR. So, Steve could have had the first dose being just measles and the second dose being MMR, and that still would have been okay for him to go to school. After review, we can say that Steve Rogers is up to date on all of his health requirements for kindergarten entry. Some of you may recall the EPI-12A forms being green and the EPI-12B forms being yellow, but nowadays they're both white. The EPI-12A forms are for preschool, Head Starts, and child care centers, and the EPI-12Bs are for grades K through 12. All schools must submit EPI-12A and 12B reports to the Department of Health twice a year, October 10 and January 10. On these reports, they should have the names of all the students who are provisionally admitted, excluded for failure to comply with immunization and examination requirements, or those who are religious or medical exempt. The reports must also include the missing immunization and dose numbers. Here we have a sample of a completed EPI-12A report. According to the report, there are 3 children who have not completed all of their health requirements. The first child has no immunization record. The second child is missing hepatitis B doses 2 and 3, and the third child is religiously exempt. Also, please remember that the total enrollment should equal the number of students less than 19 months plus the students greater than and equal to 19 months. The following few slides will demonstrate how to complete the EPI-12B forms. First, we will start with Section 1. Fill in the school's name, mailing, and location address, who is preparing the EPI-12B form, the enrollment broken down by grades, and whether or not your school has a pre-K program. If after reviewing your Form 14s you find out that all of the enrollees meet the immunization requirements, then you just have to check the box yes and turn in the form. However, if any of the children are missing immunizations, then you'd have to check no in Section 2 and then move on to Section 3, in which you would list the first and last names of the students, their birth date, year, entry date, and put an X on any of the missing vaccine doses. So in this case, Tom Immunize is missing his 4th polio dose and his 2nd MMR. Here is a sample of the final report submitted by Keiki School. If any students have religious or medical exemptions, you do not need to put an X on the missing vaccine doses. And that concludes everything that I wanted to talk about today. If you have any questions about any of the material that I discussed, feel free to contact the Immunization Branch on Oahu at 808-586-8332. Or if you're calling from the neighbor islands, you can call 1-800-933-4832. Our fax number is 808-586-7511. Or you can always email me. My email address is emerald.fujioka@doh.hawaii.gov. You can always access our website. The link is listed in the PowerPoint. And if you have any tuberculosis questions, you can always call the TB branch at 808-832-5731. I've also added a link to the school admission requirements. It's about a 15-minute video, so you can check out the link below.